History taking is the first and by far the most important step in the medical management of a patient. In this video, I am going to teach you how to take a professional medical history from a patient. Coming towards the components of a typical history, the first one is the biodata of the patient, and in this we collect information that are necessary for the proper identification and registration of the patient, and even in some cases it may point towards a specific diagnosis. We ask about the name, father name, age, gender, address, mode and date of admission of the patient, marital status, occupation, education level, and contact number, etc. Then comes the chief complaints, and in chief complaint we ask what was the main symptom that brought the patient to the doctor. It is composed of 2 or 3 words and is written in the same words narrated by the patient. The third step in the history taking is the elaboration of the chief complaints narrated by the patient, and this step is known as history of presenting illness. And in this step we elaborate step by step, and here I want to give a formula that is ODCAR, ODICAAR. And in ODCAR, the O stands for the onset. We ask whether the symptom was gradual in onset or it was acute in onset. Then the D stands for the duration of the symptom, and by this we mean the time passed since the complaint was first felt by the patient during the current episode. The I stands for the intensity. In this we ask about the severity of the disease. For example, pain may be mild, moderate or severe, or if the chief complaint is fever, then fever may be low grade or high grade. The C stands for the character. Character simply means the nature of the symptom, like pain may be dull, it may be sharp or colicky in nature, and similarly if it is fever, then fever may be intermittent, remittent, continuous or spiking in nature. The A stands for the associated symptoms. In this we ask about the complaints besides the chief complaint that are narrated by the patient. For example, in case of malaria, fever is the chief complaint, while rigors, chills, nausea and headache etc. are associated complaints along with the fever. The other A stands for the aggravating factors. This means all the things that worsens the symptoms, like pain in angina worsens with exercise, and pain in pancreatitis aggravates with meal and lying supine. The R stands for the relieving factors. It means with what the symptoms improve or lessens, like in angina pectoris, the pain relieves with the rest and nitroglycerin, and pain due to pancreatitis relieves with leaning forward. Now, after the history of presenting illness, we take past history from the patient, and there are 2 components of the past history, that is the past medical and the past surgical history. Now in past medical history, we ask about similar episodes in the past, chronic ailments or comorbidities like diabetes mellitus, hypertension, TB, asthma, rheumatoid arthritis, and history of past hospital admissions if any. In past surgical history, we take histories of any past surgery or associated complaints with the surgery or anesthesia if the patient has experienced, and we also take any history of past trauma or accidents. After past history, we take the family history of the patient, and family history includes any known genetic disorders that are running within the family, health status of other siblings and the parents of the patient, and history of any premature deaths in the family. We also ask about history of diabetes mellitus, hypertension, allergies, and ischemic heart diseases in the family. After the past history, we ask about the drug history, and in this we inquire about any history of long-term medication that the patient is taking, like anticoagulants, anti-epileptics, antihypertensives, hypoglycemic agents, etc. Then comes the personal history of the patient.
In personal history, we know about the sleep, bowel habits, and appetite of the patient, whether it is changed during the course of the disease or not. We also know about any addictions like smoking, etc., by the patient, and also history of any allergy known to any sort of food or medicines.
In last, we take a systemic history, and in this, we ask general question which may point towards the involvement of a specific organ system. Like in cardiovascular system, the following questions may be asked, like fainting episodes, any chest pain, labor breathing on exertion, or any palpitation.